hip problems cause pelvic floor dysfunctions? The answer is absolutely yes. So if you have hip issues and you have pelvic floor issues, they're related. And that's part of the problem that I'm having with what I see out there. So let me explain to you. Here's your pelvis, and your spine is connected to your pelvis, and your lower extremities are connected right at the socket. So the socket part of your hip joint is provided by your pelvis. The lower extremity has a ball that sits in this socket. So the integrity of your pelvis, which is a foundation to the structure above, which is absolutely necessary for it to be stable, is impacted by this, whatever is connected to it. Your spine, that's the structure above, and your lower extremities. And so when people have hip issues, they always have pelvic issues. The only issue here is when they talk about pelvic floor dysfunction, in the minds of most people and most providers, well, they're talking about urinary issues, maybe bowel movement issues, maybe gas incontinence, so they can't hold gas, or they just can't release gas. Maybe they have sexual dysfunction. That seems to be what people think about when they think about pelvic floor dysfunction, when in reality, that's part of the package. If you have not subscribed to my channel, make sure you do, because I've done videos on that. In fact, at the end of this video, I'll put down some of the signs and symptoms of pelvic floor dysfunction. You'll be surprised how many other things belong to that category that you might have had, but you thought they were separate problems. Hip issue and pelvic floor dysfunction is one of those examples. How can you have hip issues and not impact the socket, which is part of the hip joint? Hip joint is a ball and socket joint. The socket comes from the pelvis. So when you have, granted, you could have a hip issue as something that you did, an incident that caused or created that issue. But you can't just think that you leave it with just this area. It is going to impact your pelvis. And frankly, most often that is not the case. Most often you don't even have to have you can't pinpoint to an incident that was like, that incident happened, therefore these other things started happening. So when it comes to having hip restrictions in mobility, you have pelvic floor dysfunction for sure. You see, the muscles inside your pelvis work with the outside surrounding to stabilize the pelvis, because stability of the pelvis is foundational to your existence. Without your upper and lower extremities, you're disabled. Without your trunk, you're not there. You can't live without your trunk. So the foundation to the structure above has to be stable, and anything and everything your body is going to do to assure that. That's why you have muscles inside your pelvis biomechanically speaking, you have muscles inside the pelvis to work with the outside to stabilize. That double layering will assure longer, better stability. When things on the outside are not happening, the muscles on the inside have to react accordingly. So they will tighten up. When they tighten up, the space here gets smaller. There's pressure on your pelvic organs. Those pelvic organs are bladder, uterus, ovaries, / prostate, and intestine. You also have blood vessels in there. As a result of that, you can have pelvic congestion. If you don't know what that is, we'll make sure we put the video I did on pelvic congestion so you get to see how that's related. You can have issues related to the nerves, and we act as if that's like, oh my gosh, there is an issue on your nerve. We're gonna have to do Botox, we're gonna have to do nerve block, we're gonna have to do this, and that. When in reality, create the environment your body needs to function the right way. If you have a plant that's dying, take a look at the instruction. Are you providing the environment this plant needs to grow in? If not, make that environment, it will grow. That's no surprise. So do the same thing for your own body. Understand what your body needs for this pelvis to function properly. This is what I do here. And the reason it's successful is because I didn't create it. It's successful because I understand what this environment needs to thrive the best possible way. So when I teach my patients what that is, so that they don't have to keep coming to me, then I am transferring that knowledge to my patient, to whoever it is that I'm interacting with. And that's just really simply all that there is. I always start with biological breathing. Once again, if you haven't subscribed to the channel, please do so. I think I've already named 2 videos that we're going to put at the end of this video, so I can't put biological breathing there. Go ahead and subscribe to the channel. Search the channel for biological breathing. But do something about it. Ignoring the problem is not going to solve your problem. You already knew that, didn't you? Anyway, it was a pleasure sharing with you my opinion and my knowledge about pelvic floor dysfunction. I hope you use your the opportunity to put down any questions you have, any suggestions for any videos you have. Subscribe to the channel, educate yourself, understand that you are in charge of your own body. And at the end of the day, not getting in the wrong place is much better than getting there and trying to fix it. Hope this helped. Take care.